ORMC nurses are coming in clutch again, bringing the receipts to show you what's going on. Today we're going to be reviewing emails between the staff and management regarding unsafe staffing. Here's an email that started a bunch of fuss amongst the staff. Basically it says that their ICC is going to be stretched 1 to 5. These nurses were not having it. The first person to speak up brings up that these ratios are causing staff to leave, and not only that, but the pay is garbage. It goes on to say that he's putting his patients first. He put his foot down and he said that if he comes in and he's assigned 5 to 1, he is simply going to leave. He says the day that happens, consider it his 2 weeks notice. He goes on to mention the Redonda Vought case and how he is not going to risk his license either. Another nurse chiming in, she agrees. The nurse explains that on an intermediate critical care unit with all of these different drips and ventilated patients, it's just not safe. She warns that patients' lives are at stake. Mind you, she took time away from her vacation to write this letter, literally pleading for help, followed by another nurse saying the same thing. Okay, now Kathy chimes in. This is the person who sent the original email. As you can see, she doesn't want people replying all. Why does she do this? Because when one person shows their teeth, everybody gets brave. It's much easier to manipulate you when you're one-on-one. But remember that first nurse that spoke out? Stuck to his guns. He basically said, you're crossing the line. This one has to be my favorite because this nurse really lays down the law. With all due respect, the ratio on this unit is 3 to 1, not 4 to 1. So basically the fact that they're saying, now we might have to stretch you to 5, even though it's 4 to 1, he's calling their bullshit. I love it. This is a continuation of his email response. Literally, this is not safe in all caps. Cannot be any clearer.